Hello everybody. Welcome to my channel. This is MJ the Coding Coach. Now, if you did not see my Instagram the other day, I just feel like I have to explain myself. So if you see me, I have on one nail. So this is why. I had acrylic nails on. I took them off, but this one is split across. And I can't take it out because I'll take my real nail off with it if it comes off. So don't be like, oh, she's weird. She's got one nail on. It's cracked and it hurts really, really bad. So now we got that out the way. So welcome to the channel. This is MJ the Coding Coach. Thank you so much for joining me. Thank you so much for all the congratulations you guys have been giving me about my new dream job that I have. So today I wanted to combine days 2 and 3 together of my blog or vlog or however you want to call it. So this is vlogging about my dream job, you guys, that I started on Monday. They flew me out over the weekend. So today I want to get more in depth about HCC, my role, my job, how orientation has been going, and all those type of things. So first, I would like to say that I haven't actually started the job yet. Actually, as far as in my role, this is orientation this week where they flew me out to Chicago, and this is by far have been one of the best experiences I've ever encountered when it comes to being a new hire. Orientation, and this is by far, they set the standard, they set the bar. Like, I'm so glad and I'm so proud and I'm so happy to be a part of such a great company. It's also a startup company. It hasn't been around a year yet. It's a startup company, but this startup company is so innovative. They came in a time where their services were needed. No one else was offering it. So it's just, they were innovative in it, and it's also going to be, they're going to be an industry leader. So let's get more into the things I'm talking about, to be more specific. So first, I would like to talk about the CEO of the company that I'm working for. His name is Jeff Kane. He is the CEO of the company. He used to be the chief medical officer for CMS under the Bush and under the Clinton administrations. So you know he's like super knowledgeable, connected, knows what he's doing, knows what he's talking about. If the presidential administrations had him a part of their teams. So Dr. Kang is also responsible for creating and rolling out and implementing things such as HEDIS. I'm sure you guys are familiar with HEDIS. If you're not, please look it up. H as in Harry, E as in elephant, D as in Delta, I as in ice cream, S as in Sam. HEDIS. HEDIS measure. HEDIS stars, caps, all of those are quality measures. There are set in place by CMS to make sure that their Medicare patients are receiving the quality care that they need or the quality care that they deserve. And you're just not flying them in and out, and you're not speaking to them nice, and you're not scheduling their appointments on time. So those HEDIS measures and those stars and caps and things like that, it measures the quality of care and the quality of service that you're providing for the patient. So the company I work for, what makes me say is such an innovative company, check this out. So as you know, over the past year or so, we've been going through COVID-19. COVID-19 has stricken the country in a lot of ways. We're limited to what's open, limited to how many people are at certain places. So the company I work for, they offer home-based value care, home-based care. So that's different from home health. That's different from, of course, skilled nursing facility. So what we do is we have a team of doctors, physician assistants, nurse practitioners, licensed social workers, coders, and we have medical assistants, which we call the care team coordinators. So that comprises of our company interdisciplinary teams that goes into making everything flow. So what our company does is we go into the homes of the patients. The patients can call us 24/7. We assume, our company assumes the full risk for that patient. Let me give you an example. Our company has partnered with a huge healthcare payer, Aetna to be exact. So what happens is Aetna will pay our company. Aetna will say, hey, this person is extremely sick. It's taking a lot of money to manage them. You're saying that your company can help us control some of this cost by helping our patients get better. So what we're going to do is we're going to allow you access to these patients. And if these patients agree to come on with you and your company through us, it's going to be covered now. They won't pay any additional costs. But if they agree to use your services in addition to being under us, then we'll give you the money for that patient. All the money that we would have received for that patient, we'll give it to you. And you manage the cost. Anything that the patient needs is going to be your responsibility. So that's what I mean by we assume the full risk. Up front, Aetna will give my company money for this patient. So our responsibility is to make sure that this patient is healthy, make sure this patient doesn't get any sicker, and make sure the cost for this patient is ultimately down. So how we're going to do that is, that's where the team comes in. The care team coordinator is going to be responsible for scheduling the appointments and make sure the patient is getting the services they need. So the nurse practitioner can go into the home to see the patient. And let's say the patient is having an emergency and they feel like they need to go to the emergency room and things like that. Keep in mind, my company has assumed the full risk for that patient. So if that patient goes to the emergency room, my company has to pay because the insurance company already paid us for that patient. So our responsibility is to make sure we prevent things with this patient to keep the costs down. Again, like I said. So instead of that person calling 911 in the sense of the emergency, they have access to our doctors and to our nurse practitioners 24/7. 24/7. So if that elderly person, and we deal with geriatrics, is a senior medical facility that I work at, or a home-based care facility. So what that patient would do is, instead of calling 911, they would call their nurse practitioner or their doctor. Hey, something is going on. I think I need to go to the emergency room. I'm not sure. And instead of the ambulance coming and they going to the emergency room, they're accumulating a lot of charges, our on-call doctor is going to see and assess that patient. And if it's something that it needs to be immediately addressed, that doctor or that nurse practitioner or that physician assistant then say, hey, yeah, we need to go ahead and go to the emergency room. Or if it's something that they can manage there, then they've saved that patient a visit. They've saved Aetna money because they're not sending their patient to the emergency room. We handled it here. And ultimately, it's saving my company some money because if we don't use all the money that they give us for the patient, now we have to use 85%. It has to go back into the patient's benefit. But if we don't use all of the money, and that's how it's a slight profit for the company. So everybody is winning. The patient gets 24-hour access to a physician. Licensed social workers come in the home. They might need a light bulb changed. Counseling sessions, whatever. So we're offering quality service to the patient. So the patient is winning. The insurance company is winning because we stopped that patient from going to the emergency room. We intervened and we handled it so that nurse practitioner was able to assess and address and treat whatever the problem is, so that patient did not have to go to the emergency room. So it saved the insurance company some money. And it also put money into our business or our company, being that that patient did not have to go to the emergency room, so we did not have to pay out for that visit. Because remember, we did assume the full risk for that patient. Also, it's a difference between value-based care and fee-for-service. I love value-based care more is because it's about the value. It's about the quality of care that you're receiving. Fee-for-service, exactly what it sounds like. Fee for a service performed. So let me give you an example. Let's say that someone's going in for an amputation of the left foot. So they go to the doctor, they go to the hospital, they go to the emergency room. They go to the operating room, everything. So the doctor mistakenly amputated the right foot, which is the wrong foot. So in fee-for-service, not only will their doctor get paid for amputating the wrong foot, then the doctor again get paid for amputating the right foot. So that doctor got paid twice, although they messed up on what they were supposed to do. So fee-for-service is like heads and beds. You know, it's like you do something, we pay. You do something, the more you do, the more we pay. The more you do, the more we pay. So I don't like fee-for-service a lot because some physicians or some companies can take advantage of fee-for-service, which means they can just do things and just unnecessarily knowing that it'll be a fee attached. So value-based care is the care that you're going to receive based on the value. Like I was talking about earlier, the HEDIS measures, the stars, the caps. If you go to CMS, they have quality measure to show you how many stars these Medicare or Medicare Advantage plans have. So I like value-based care more because they are measured on the quality that the patient is receiving. And so also with HCC or with our company, the sicker the patient is, the more money that the insurance company will give us for that patient because we have to manage more symptoms, more things to treat and stuff like that. So that's where HCC comes in as far as capturing all of the chronic conditions. Because if you got all these chronic conditions, then the insurance company is going to pay us for managing all of these chronic conditions. So, like I said, again, my company is innovative in the fact that they're ahead of the game. So now a lot of people are going to try to come into play with the, trying to do home-based things because of COVID or whatever. But the company I'm working for is kind of like already ahead of the game on that. So we did a few exercises and orientation as well that they were very, very, very insightful. Like I said, I'm working with geriatrics patients, which are older. You know, pediatrics is kids. Learn your medical terminology. Pediatrics is kids or children, adolescent. Geriatrics, older people. So learn your medical terminology. So we did a lot of exercises for orientation that allowed me to empathize with geriatric patients. Now, I've always been considerate, kind, and things like that. But the exercises that they offered in orientation actually made me put myself in their shoes. One of the exercises was this. So a lot of people, especially when you're dealing with chronic conditions and things like that, they're dealing with sight problems because, you know, diabetes. Most of everybody, you know, all older people, they have high blood pressure, diabetes, heart problems and things like that. So diabetes is one of the most common. And diabetes is so serious because it affects almost every organ system in your body. It affects the eyes, the heart, the circulatory system, just everything that can be connected to your diabetes and cause something else to get out of whack. So the exercise that we did that made me just fully empathize with geriatric patients. So on the outside of the bag, it was a little bag. And inside the bag it had some contents. And so the bag had some glasses that were scratched up really, really bad on the lenses. It had a bag of M&Ms and Tic Tacs. I'm thinking about the app. So it had a bag full of Tic Tacs and M&Ms, all different colors and shapes. Scratched up glasses, and it also gave me instructions. Oh, and it had 2 pair of gloves. So what they did was, that exercise was to have me empathize with older people or geriatric patients who are having sight problems and neuropathy issues where you can't feel your hands or your legs or is in pain or things like that. So what the exercise had me do was put the glasses on. Now keep in mind where the glasses are, it's completely scratched where the eyes, where I'm supposed to look out at it. So I had to put the glasses on. I had to get the M&M, the bag of M&Ms and Tic Tacs. I had to get the M&Ms and Tic Tacs, pour it out, and I had to separate it by color and shape. And I also had to do it with 2 pair of gloves on. So as I'm sitting there with 2 pair of gloves on, barely can see, trying to separate this M&Ms and the colors and the Tic Tacs, it gave me the notion of this is how older people are when they're trying to take their medicine. It's frustrating. I can't feel my hands. My eyesight is leaving. My glasses may be scratched up, may not be the best. And I'm trying to decipher which pill is which, and I have about 9 or 10 different medications. So that's a lot. So it made me truly empathize with geriatric patients in the notion of that's a lot to go through trying to find your medicine, your sight is going, and all of these other things. So that was a great exercise. Great exercise. So again, with HCC coding, you're not dealing with any you're not dealing with any CPT. And let me give you an example of why we're not dealing with any CPT codes. And I'll relate it to my company, and it'll maybe make more sense to you as well. So the company I work for, like I said, we send physicians and nurse practitioners, that Southern Memphis, Tennessee accent. And so we send them out to the homes. So we're looking for the chronic conditions. Like I said, the more things that are chronically wrong with them, then the insurance company will pay us to manage it because it costs more to manage all these chronic conditions. But when the doctor goes out, they're not going to use any CPT codes for the visit because it's like we're paying ourselves. So if the doctor add a CPT code to put it on a claim, they're essentially paying themselves. So it is not a need for a CPT codes. We're just only dealing with the chronic conditions so we can let the insurance company know what's going on with this patient and how much it's going to cost to treat this patient. So let's see what else. I've written down some things. So that was pretty much it. Second day of orientation, we just went over things about the company, their values, what they stand for. Another thing that why this is going to be so helpful as well as far as the care of the patients, this is who's going to benefit the most. Not the insurance company, not our company, but the patients. They're going to benefit the most. Think about this. If a patient comes to the doctor, they're all dressed up, they're looking good, they're smelling good, somebody got them ready for the doctor and they came in and they received their prescriptions and you saw them, you checked off all the boxes, everything's okay. So when the patient comes to the doctor, you really don't get a true sense of what's going on with this patient at home. It could be things that's going on at home that's affecting this patient. Let's say the patient was obese, but still came in smelling good, looking good, everything's fine, they're talking good, and you're wondering, why is this patient, I've given this patient a diet, this is going to cause heart problems or things like that. Why isn't this patient losing the weight? Well, with our company, we come and see you in your homes. We come and see you. Like, a lot of elderly people don't want to get out now because of COVID. It's a lot of stuff going on. So we come to you. And again, you have 24/7 access to our doctors, physician assistants, and things like that. So that's another thing. And also, there are things that are going on in these homes that you wouldn't normally know about if the patient was just coming to the doctor. For example, they may have a family member who's abusing them at home, who's yelling at them. They may have a whole cabinet full of junk food at home. That's why they're continuing to have problems with their diabetes or problems with whatever is going on. So by us coming into the homes, we can get a glimpse of their social life. And sometimes your social environment does affect your health. If someone's at home abusing them, that's why they're depressed. If no one is buying you the proper food and you got junk food and things like that, that's why your diabetes is not being controlled. So being inside of the homes, like I told you guys, this is innovative and came right at a time with COVID. Nobody thought about to go ahead and do that. And of course, you have home health aid where somebody sits there all day or 24/7. So we don't do home health. What we do is we manage your health. It's like you can still keep your primary care doctor with seeing our physicians and things. So it's not like you have to get rid of your primary care doctor through the insurance. Now that's the idea, because even when that person sees the primary care doctor, we pay that primary care doctor for seeing that patient. Remember, when the insurance company releases this patient to us, we assume all of the risk. We assume the whole risk. So it would be ideal for that patient to say, I don't want to see my PCP anymore that I had, directly through Aetna. I like your company. I like everything you guys are doing. You guys call me. I have access to you 24/7. You guys come change my light bulbs or anything. If you're here, just help out extra. I want everything to go through you guys. And so essentially, That cuts out the PCP and gives us all of the money for this patient, and we're just managing it this way. So yes, it's a very, very, very innovative system. I absolutely love it. Absolutely love it. Let's just say, make sure that I didn't skip anything. Oh, this is another example. So when I was talking about it's not a fee for service. So let's just say a patient wanted some extra visits through their primary care doctor or something like that. So those visits, it's going to cost. It's a fee for service. Every time that patient goes to the primary care doctor or whatever they're getting done, it's a fee for service. They're getting charged. Well, let's say if you come with us through your insurance company as well, and you want to do everything through us, we're not charging for if you will need extra visits. If your health requires 2 visits or 3 visits a month instead of 1, there is no extra fee for the extra visits. That's why I said with our model, the patient is getting the best service. So we're not charging every time we're seeing the patient. You know, it's not a fee for service. You know, if you want me to come and see you, you got to give me more money. No, we're assuming the full risk. So whatever that patient needs, then we're going to accommodate that at no additional cost because the insurance company is already giving us the money for that patient. So HCC, another little thing to know about that as well. Every year you get a risk score. It's called RAF, Risk Adjustment Factor. Now your demographics play a part. If you're a man, you're a woman, how old are you, or what's going on. So every year the patient has a risk score that starts over. So let's say, prime example, 2020. So the patient went to the doctor all 2020 or whatever. And so they accumulated a risk score by the things that were wrong with them during that year, how many times they went to the doctor, the demographics, what's going on. So at the end of the year, the physician, the company, the insurance company, the payer, everybody can say, in 2019, their risk score was a 1. And 2020, their risk score is a 2, which is higher, which means a higher risk. That means this patient is getting worse. With those risk scores, you can determine if the patient is getting better or if the patient is getting worse. And that's how the insurance company knows to give you more money or give you less money. That's why HCC coding is very important, because it captures the risk of the patient. The lower the risk, the better or the healthier the patient is. The higher the risk score, the more burden it is on the company or the insurance payer to take care of this patient. So that's why HCC coding is very important, because it captures the true meaning or the true identity or the picture of what's going on with this patient. So what happens is the insurance company pays us and we assume the risk for the patients. So I am going to end this because I am about to head on over to orientation. It is about 8:30 and it starts in just a second. So make sure you guys, just to recap, I want you guys to look up HEDIS, H-E-D-I-S. Make sure you go and take a look at HEDIS, CAHPS, C-A-H-P-S, and STARS, those CMS quality measures that I told you guys that my CEO helped implement as the Chief Medical Officer of CMS during the Bush and Clinton administrations. So go ahead and check that out. Thank you guys for joining me again for this blog of my week here in orientation in Chicago. Don't forget to like, to comment, and subscribe. Also hit that notification bell so every time I drop a video, you will know that I've dropped a video. Also, don't forget to follow me on Instagram at thecodingcoach_CPC, and on Facebook, my good friend Terriante Levels and I have a Facebook page together, and it's called Dynamic Billing and Coding Group. So again, I'm having an HCC workshop coming up. So be on the lookout. Join our platform so you don't miss it. It's going to be a limited amount of spaces. Thank you so much for joining, and you have a great, great day, and I'm headed to orientation. I'll see you guys later or tomorrow. Thanks.